All right. Welcome to the Arts and Health Grant application walkthrough that is now open for April 2025. A brief agenda of what I'm going to go over. I'm going to introduce this program. I'm going to go over the program goals, eligibility requirements, funding rules and restrictions, how to start your application, evaluation criteria and definitions. We'll do a little application walkthrough and I'll give you a glance at what it looks like on the RISCA portal, and then ways to get more help and questions at the end. This program awards up to $7,000 for this grant. This is a slight decrease from previous years. We've restructured all our grant programs and redistributed the amount. Our budget has stayed the same over the years for the overall RISCA grants that we fund out because of level funding through the state department, through the state. So we have readjusted the amount. So anyways, you can ask up to $7,000 for the Arts and Health Grant. And this is open to 501c3 nonprofit organizations based in Rhode Island or groups fiscally sponsored by a nonprofit. Artists are involved in this, but the artist is not the applicant. The organization is the applicant. And this grant, the Arts and Health Grant, supports arts and cultural projects or artist in residence programs that contribute to overall health and well-being for individuals and communities. Non-clinical arts activities may occur in health-based or community spaces. And these are non-clinical arts activities. These are not designed as a clinical intervention to cure a disease, for example. Arts participation has been linked to positive health outcomes. For individuals, this may include social, emotional, physical, and/or physiological health benefits. And the arts and culture can also address the social determinants of health. And these are the environments where people are born, live, learn, work, play, and age, to promote thriving communities by raising awareness and reducing social stigmas. And that's the focus of this grant. So when it comes to health, the idea is that these projects are using non-clinical arts experiences to improve the quality of life and create environments helpful to the individual or group health and well-being. So this may include individuals, patients, facility residents, caregivers, and staff in healthcare or community settings. And in terms of public health, utilizing the arts to address the social determinants of health, to promote artists as partners in strategies to build healthy communities for all of Rhode Islanders. So the timeline for this grant, as I said, it opened February 1st. The deadline is April 1st at 11:59 p.m. It's an online system. It'll automatically turn off at 11:59, and there's no exceptions. Nothing will be accepted after that. And the funding period supports a project occurring between July 1 and June 30th, which matches up with the state's fiscal year. Grant notifications will be sent out around mid-June. This is tentative. It's based on our council meeting to approve the grants and also the approval of the state budget for the new fiscal year starting July 1. And then a final report is due the July 31st following the project period. So eligibility for arts and health, I'm going to go over some specific to the Arts and Health Grant, and then I will get into other eligibility requirements later on in the presentation, more about the organizations. So this project addresses a health need or challenge and specifies how non-clinical art-based experiences or an artist residency promotes positive health outcomes for individuals or communities. There is direct participation of the artist as a core element of this project. And then a health professional or subject matter expert is an advisor on this project. And those are requirements to move forward to the panel process. I'll give just a few hypothetical examples, and we can talk more later on. I'm not going to read all of these. They'll be available in this presentation that I will also email to you in a follow-up email. But First, a senior center offers an interactive 12-week music program to stimulate memory and cognitive awareness for individuals with Alzheimer's disease or dementia and their caregivers. And another example could be a substance misuse treatment center offers a series of 8 workshops presented by professional artists, and the medium could be dance, movement, singing, painting, storytelling, poetry, or writing. Not limited, those are just examples. To enable participants to explore their own experience, build a sense of belonging, and develop skills that will assist with their ongoing recovery. Public health examples. One example could be a homeless shelter partners with a mural artist to create artwork that communicates the experience of being unhoused, and the resulting works are displayed in a community center to help build understanding of the causes and challenges related to this experience. Another example could be a senior center and school co-organize an artist residency to present oral histories, writing, and visual art workshops. Seniors and students tell, write, and illustrate stories to facilitate intergenerational connection and reduce social isolation. The event culminates with the publication of a book, public readings, or an exhibit at the senior center and school. And I give these examples just to be examples. They are not prescriptive, and they are not meant to be prohibitive in other ideas. Eligibility for organizations. In addition to the arts and health eligibility requirements that I mentioned, you must be a nonprofit organization conducting business and incorporated in the state of Rhode Island as a 501c3 with tax exempt status from the IRS. You're registered with the Rhode Island Secretary of State, and you're governed by a revolving board of directors, trustees, or advisory board drawn from the community at large and actively involved in the governance of the organization. And if you're not a 501c3, a Rhode Island-based organization using a fiscal sponsor that fits the above requirements is also eligible. But just again, a reminder that this is not, the artist is not the applicant, but the artist is a vital piece of this application. If you're an out-of-state organization, you may still be eligible. And to be eligible, you must show the principal place of business is in Rhode Island, registered with the Rhode Island Secretary of State's office, and produce programming predominantly in Rhode Island, and be governed by a revolving board of directors, trustee advisory board, drawn predominantly from the Rhode Island community. And if you're applying with a fiscal sponsor, you need to adhere to the requirements that were just stated previously about a nonprofit organization. And the sponsor must be financially, administratively, and programmatically responsible for all conditions of the grant. And the nonprofit organization acting as a fiscal sponsor does not limit them from applying for grants for their own programs. The fiscal sponsor, again, is just the agent that's allowing the organization to apply, but they're not doing the project. And oftentimes there is a small administrative fee for being a fiscal sponsor. Again, the RISCA definition of a nonprofit organization as stated above is required for a fiscal sponsor. And the fiscal sponsor is required for signing any grant documents and ensuring that following all the rules, and submits a final report. And the organization, the fiscal sponsor, is not a project partner in this application. Again, they're just serving as the fiscal agent. Other eligibility is more broad for organization grants. The organization is not receiving direct funding from another RISCA grant, and the organization is not applying for another RISCA grant at the same deadline. Even if it's not for the same project, you have to select one program to apply to. You also can't request support for this project or aspects of this project through another RISCA grants program. If you're a general operating support organization receiving funding from RISCA, you're not eligible to apply, and there can't be any delinquent final reports for previous RISCA grants. And the funded portion of the project activity takes place in Rhode Island, and the program occurs in spaces that are ADA compliant. So then we'll go on to funding rules and restrictions. All grant awards are contingent on the availability of funds from the Rhode Island General Assembly and the NEA. The max grant award in this category is $7,000, but partial awards are common, and partial awards will be no less than 50% of the application request, or $1,000, whichever is higher. All grants are considered on a competitive basis, and award amounts may vary cycle to cycle depending on available funds, number of applications, and the panel decision making. And if you receive a partial award, you can modify the project. We don't expect, if you don't get your full funding, that you would carry out the project as originally described. We assume that there would be some modifications. You could also decline the grant award if you don't get the full amount or things change without any penalties. We don't hold that, as a negative impact for future applications. And if you receive a grant, you must credit the agency on all marketing materials. For not allowable expenses, grant funding cannot be used for the following. There's a list of, I'm not going to read them all, but they're in the guidelines. And there'll be an attestation that you will have to sign off on. The other piece just to note is the Arts and Health grant does not fund clinical arts activities, and the grant funds cannot be used for artists or health experts that are eligible for third-party billing. The panel that will review the grants, there'll be 3 to 5 individuals. The RISCA staff are not the panelists. That's why I'm able to meet and talk about your application up until the deadline and give advice, because I will not be on the panel. I will just facilitate the panel. The individuals who, it will also include individuals who work in the arts or health sector. There'll be at least one professional artist on the panel, and there will be maybe an individual who work at the state or local arts agencies or similar vantage point in the arts and cultural ecosystem. And the panel reviewers will use the evaluation criteria to evaluate and recommend applications for funding. So I'm going to go over the evaluation criteria and definitions. And we've recently restructured our grants, streamlined against all of our programs to think about, we got rid of our old, more cumbersome rubric and simplified it to this evaluation criteria. So they'll be looking at logistics, artistic vibrancy and impact, and then program specific criteria. So for the Arts and Health grant, that would be the health benefit and impact. So in terms of logistics, and it's really important to keep the evaluation criteria in mind when filling out the application, because these are the pieces that the panel will be viewing and judging your application on. So we were trying to make it as clear as possible. So the logistics section, it just clearly states what will be done by whom, when and where things will take place, how it will happen, both logistically and financially, and metrics that will be measured. What does a successful project look like? Artistic vibrancy and impact is the next part, and this is really important. We're a state arts agency, so we're funding arts, and we believe that arts has an important impact in our community. So art is central to this project. The artist or artists will provide a positive and purposeful experience for the participants, and the project provides access or engages underserved communities as identified by the NEA. So you can refer to the attended participants' audiences, the applicant identified under logistics. We go through the application. I can show you what that looks like. And the next section is, again, the program specific, the health benefit and impact for this grant. So this is where you'll state that how the project addresses a health need challenge and specifies how engaging with the arts will improve health and quality of life for individuals and their communities. And again, this is what the panel is going to be looking at and evaluating. They're also going to look at how the health and or community partners are integral to the design and implementation of this project. Okay, and then it'll be time to start your application. So you think about things that you'll need to gather. The first part will be eligibility documents. And so since the organization is the applicant, that will be the 501c3 IRS determination letter, a unique entity identifier from sam.gov, and recent 990 from one of your past 3 fiscal years. And so that would be the completed 990. And so for 2024 would not have been completed yet. So that would be from FY 21, 22, or 23. If you have any questions, you can always ask me about that. And if you're using a fiscal sponsor, you'll need the fiscal sponsor's letter, their determination letter, their recent 990. And then the documents for the panel review, that will be a project budget on the RISCA template, a project plan, again on the RISCA template, a bio CV resume, not all 3, but one of those of the artist or artists involved, and a bio CV or resume of the health advisor or subject matter expert. And then artistic work samples, up to 3 samples showing how the artist involved in the project have experience relevant to this project. All of those will get uploaded to a Google Drive folder. And then there'll be a work sample list just to describe what's being included. And then 1 testimonial from a person or people who have experience with this program. So again, that's just to give you a checklist of things that you will need. It's a little simplified from previous years in focusing on what is relevant and not having extra stuff uploaded. Okay, now I'm going to give you an overview of the application. So the first section of the application, and again, I'm going to actually go online and show you what it looks like in the grants portal, but I just want to give an overview here. So the first section is for the RISCA staff to determine if the applicant meets the eligibility requirements to move to panel. And that is where the uploads for eligibility and an eligibility checklist exist. And that section will only be seen by RISCA staff. There's no need for panel to see your 990s or any of the other information. And then section 2 is going to be for the panel to learn about the project, to review and score it based on the evaluation criteria I just went over with you. And again, those are in the 3 parts. The questions and sections match the evaluation criteria to make it simpler, easier to understand for both the applicant and for the panel. So again, the logistics, the artistic vibrancy and impact, which will have the narrative questions, and then program specific, which will have a narrative question and a testimonial upload. To log into the RISCA Grants portal, here's the URL here. It's also in the guidelines on the website when I sent you. Just to let you know, we have 2 portals, one for artists and one for organizations. And so this is the one for organizations. And then when it is time to log in, once you click on that, you will see that this is what the online portal looks like. And it'll say, welcome to organizations. You know you're in the right place. You'll enter your email and your password. If you're new, you'll create an account. If you're unsure if there's already an account or if this organization has applied before, you can contact me and I can let you know. There's also a new feature, depending on how long ago you applied. There's a collaboration feature. So oftentimes an organization might include the artist or other people in their team to collaborate on the application to have access to it. I can do that. I can add extra emails, so that's not a problem. And then once you log in, you will get to this screen, and it'll have all the open applications that RISCA has at this time. It's sorted alphabetically. So arts and health will actually be the first grant listed, and a little description will be here. There's an apply button right there. So I'm going to just stop sharing this screen for a moment because I'm going to click on over to the online portal so I can show you what that looks like. So I am just going. Can everybody see the application here? I am going to, so I'm going to show you. This is the application once you're on. The beginning section will show you resources. It'll link to the website and the guidelines. Okay, great. Thank you for confirming that. So this will show you the application. It's where you can download the project plan template, budget template, work sample template, and the fiscal sponsor letter if needed. This is also all available on the RISCA website if you don't know where to find them, but we just have them in more than one place. Then you'll see the different sections. As I'd mentioned before, the first section is only for RISCA staff. This is where you'll find the eligibility checklist to confirm you're a nonprofit organization, whether you're using a fiscal sponsor, a very simple eligibility checklist. If any of you have applied before, the eligibility questions were a little more complicated with double negatives, and we tried to simplify that to confirm you have a UEI, that there's a health professional or subject matter expert involved, name of your organization, and then place to upload the materials that will be required for me to do the eligibility check. There's also a question about, will you accept partial funding? And this in no way has any impact on whether you receive partial funding or not. The panel does not see this. This is us just to collect information, whether, and it's the first year we're asking that, just to have an idea if it is, if that's okay with you. But again, the panel is not going to see it. That's not how they're going to judge it. We just are doing that for information collecting. The next section, close this, and just use these arrows to close. Again, you'll see these three next sections say for the panel, and that this is what the panel will see. So the first section will be logistics. Who are you? Organization, mission, project name, brief project name, a brief summary that will be front facing. This is where you request the amount. And again, these are just very simple check boxes, start, end date, a checklist of who the intended participants are. You'll click all that apply. We don't expect you to serve all these populations. We want you to thoughtfully think about which populations you'll be serving with the project you're determining. And so there's a list there. Again, information about the artists who are involved, who the subject matter expert is, project coordinator. Again, we're trying to simplify this to really make it clear to the staff and to the panelists to just understand simply, without it being a narrative, what is the project, who are the people involved. And then there's spaces to upload your project plan. The next section is metrics for success. And in the past, we've had a narrative question about how you determine success. What will that look like? We got rid of that question, and we want to know just how you're going to determine success. What are you going to be measuring? And in this section, to make it simpler, we're not asking you to tell us how you will do that, but what you will be measuring. And so it's a simple checklist. If you have questions about how you want to measure that, and I'm happy to talk to you about that. But again, we're trying to simplify it a little so that if you haven't gotten the grant, you're not having to write another long narrative question explaining that. And then just an attestation about that you understand what the funds cannot be used for. And then also a place to upload your project budget. And that's the logistics section. The next section is artistic vibrancy and impact. And this is where narrative questions are. It's a little shorter in the past, less character counts. We don't mean to make that more difficult because there's less character count. We really just want you to be more focused and succinct, and for the panel to be able to read quickly, because they're reading a number of applications, that it directly aligns with the review criteria. So how is art central to the project? How will the artist provide a positive and purposeful experience for the participants? And then how does this project provide access for the engaged, underserved communities as identified by the NEA, as related in your logistics? And this is, again, is for the arts and health, what's really important is we know there's a lot of really talented, experienced artists out there. And this is your place to describe how the artist that was selected is relevant and meaningful for this particular project and these participants. That just because an artist has a lot of experience, is very talented, they may or may not be the right fit. And so this is your place to be able to share their experience and how it's relevant. So this is where you would upload a bio, resume, or CV. Definitely they don't need to include all. If there's more than one artist involved, you can attach them into a single PDF. Optional space for organization website, artist website, social media, link to Creative Ground profile if they have one. And then a place to upload the work sample list, and then documentation of up to 3 work samples. And this will be a link just to a Google Drive. It's no longer uploading all the pieces of art. Sometimes the panel found it hard to be switching if it wasn't consistent around all the applicants, and maybe limits on how big a file could be. So now it'll be a link to the Google Drive. If there's a password required, you'll put that in, and then the panel will just go over and be able to easily see the artwork or examples of the projects, past projects. And then the next section will be for the panel, and this is the health benefit. There's just one narrative question, and this is how you describe a health need or challenge and how engaging with the arts, the artist that is going to be involved, will improve the health and quality of life for the individuals and or communities. So there's a little description about whether it's health focused or public health focused to have you think about that. And again, a reminder that these engagements are non-clinical experiences. These are not treatments or eligible for third-party billing. This is, we believe in the value of the arts can have a therapeutic benefit, but they're not clinical at the outset. And if there's any confusion around that, I'm happy to talk about that. And then this is where you'd also upload the bio resume of the health professional or subject matter expert. In some cases, this might be someone at the organization. This might be someone outside the organization. It may be the artist. Sometimes the artists are also trained as a counselor, or might be have additional credentials that would make them suitable to be the arts health professional expert. But again, that's on a case-by-case basis. And then this is where you would also upload a testimonial saved as a PDF. And again, instead of having multiple testimonials in the past, we're just asking for a single upload, be quotes, someone who's had experience with the project or artist in the past in a health capacity, or from a partner organization, something that feels relevant to this particular project or projects in the past that might speak to the authenticity of this proposal or the artist experience. And then the next section, again, it says for RISCA staff, this is just the organization looking up who their congressional district is, and then just signifying a 1 or a 2. For us, we want to know who we're serving across the state, and our representatives want to know that as well. And then the last section is the insurances section. Brief description, just to read and to certify that to the best of your knowledge, everything that was included in this application is truthful. And then that's it. So I'm going to stop sharing that right now. I'm going to bring up the other. Make sure I'm on the right. Bear with me, I just need to share the right screen. Okay. Okay. I'm gonna open it. I'm gonna stop sharing in just a minute. I'm gonna open it up to questions. I'm gonna leave it with this last screen that also shows that after we do questions, that there'll be more opportunities to get help, a link with where the grant guidelines exist on our website. There's webinar recordings and other videos on our YouTube. I'm going to post this recording there, as well as there's a budget tutorial on our YouTube. And then we have other drop-in office hours on Zoom. There'll be a drop-in for arts and health. And then if you want to have a one-on-one phone meeting with me, you can sign up to my Calendly link. And then again, I'm the Arts and Health Program Director, Anissa, and I have an email address. So I am going to stop sharing. I'm going to open it up to questions. I'm going to stop recording.